So we will take a section in the upper part of the medulla, which will pass through the floor of the fourth ventricle, and it will pass through the middle of the olives. So we will take a section in the middle of the olives. So what are all the features we see in the transverse section of the medulla at the level of olives? So if you see carefully, this is the floor of the fourth ventricle. So it is the open part of the medulla. So the central gray matter, the nuclei which are present in the central gray matter, they are being spread laterally along the floor of the, this is the floor of the fourth ventricle. So they are being spread along the floor of the fourth ventricle. So medial most in the posterior aspect, we have got the hypoglossal nerve nucleus. Hypoglossal nucleus and nucleus intercalatus, which is present lateral to that. And then lateral to that, you have got the dorsal nucleus of vagus. And just ventral to this, you have got the nucleus tractus solitarius. And lateral most, you have got the vestibular nucleus. So from medial to lateral, you have got the hypoglossal nucleus, then we have got the nucleus intercalatus, then you have got the dorsal nucleus of vagus and nucleus tractus solitarius and the vestibular nucleus from medial to lateral. So because the part of the medulla is being opened, it is forming the open part of the medulla which forms the floor of the fourth ventricle. The nuclei which were present in the central gray matter, they are being distributed along the floor of the fourth ventricle. They are spreading laterally. So in this section, we are taking the section at the level of olive. So the important feature which you see here is the inferior olivary nucleus. So this is the inferior olivary nucleus. So this inferior olivary nucleus, it gives the appearance of a crumbled bag. So it gives the appearance of a crumbled bag. So if you see, there are two accessory olivary nucleus which are accompanying this inferior olivary nucleus. So this is called as dorsal accessory olivary nucleus, and this is called as medial accessory olivary nucleus. Okay. So this is the dorsal accessory olivary nucleus and this is the medial accessory olivary nucleus and this is the inferior olivary nucleus. So we call it as the olivary nuclear complex. So this is the important feature which we see at the level of the olives. So coming to the paramedian position. So this is the paramedian position on either side of the midline. We see these nerve fiber bundles. So the first one which we see is the medial longitudinal fasciculus. So posterior most, we have got the medial longitudinal fasciculus. So ventral to that, you have got the tectospinal tract. And more ventrally, we have got the medial lemniscus. So in the paramedian position, we have got the medial longitudinal fasciculus, we have got the tectospinal tract and the medial lemniscus. So in an order from dorsal to ventral aspect or from posterior to anteriorly, these are the structures which are present in the paramedian part of the medulla. And then if you see just lateral to that, you can see the presence of one nucleus which is called as nucleus ambiguus. Nucleus ambiguus. So this nucleus ambiguus which is there, it will give, it is present deep to the reticular formation, deep within the reticular formation, and it will give origin to the motor fibers of the 9, 10 and 11 cranial nerves. So in this section, you see the emerging of two nerves. We see the emerging of the hypoglossal nerve and we see the emerging of the vagus nerve. So the vagus nerve, it takes its origin from all these nuclei. It takes the motor fibers will arise from the nucleus ambiguous, and then you have got fibers arising from the dorsal nucleus of the vagus, and you have got fibers arising from the nucleus tractus solitarius. So all these fibers will unite to form the vagus nerve. So this will emerge ventrally from the medulla, and the fibers from the hypoglossal nerve nucleus will emerge ventrally on just lateral to the pyramid from the ventral aspect of the medulla as the hypoglossal nerve. So we see the emerging of the two nerves, hypoglossal nerve and the vagus nerve. So, and apart from this, we see the here we see the spinocerebellar tracts, and you see the spinothalamic tract. So this is the dorsal and ventral spinocerebellar tracts, and you see the lateral spinothalamic tract. So important feature which we see here is the olivary nuclear complex, and then anteriorly and posteriorly you see two important conspicuous structures. So this is the pyramid. So this is related anteromedially to the arcuate nucleus. Arcuate nucleus. So this is the arcuate nucleus which is present anteromedial to the pyramid, and posteriorly the important structure which you are being able to see is the inferior cerebellar peduncle. So this is the one which consists of the nerve fibers which will connect the medulla with the cerebellum. So as a whole, if we see, just to summarize, we see the nuclei which are present in the central grey matter are being scattered laterally along the floor of the fourth ventricle. So medially in the posterior aspect you are seeing the hypoglossal nerve nucleus, dorsal nucleus of vagus, nucleus tractus solitarius and vestibular nucleus. And then here you see the spinal nucleus of the trigeminal nerve with its tract. And ventral, you see this is the nucleus ambiguous, and in the paramedian position you are able to see the median longitudinal fasciculus, tectospinal tract and the medial lemniscus, and you can see emergence of two cranial nerves, that is hypoglossal nerve and the vagus nerve. You can see the olivary nuclear complex that is formed by the inferior olivary nucleus and its two accessory olivary nuclei, and anteriorly you have got the pyramid which is occupied by the pyramidal tract, and anteromedial to the pyramid you have got the arcuate nucleus, and in the posterior aspect, that is dorsolaterally, we have got the inferior cerebellar peduncle. So this is in total about the transverse section of the medulla at the level of olives.